Welcome to the Ken Education YouTube channel. In this video, we will discuss about the layers of the brain. So the layers of the brain will be called as meninges. Outermost layer will be called as dura mater. Middle layer will be called as arachnoid mater, and innermost layer which is adhered, which is attached to the brain parenchyma will be called as pia mater. So one by one we will see. See, on the top we are having what? We are having the hairs. This one is hairs, isn't it? And this one, the skin which is holding that hair will be called as scalp, isn't it? So the scalp, after the scalp we are having what? We are having the covering of the bone. The covering of the bone will be called as what? Periosteum. Okay, periosteum. So what is this? This is the skull bone. This is the skull bone. Okay, the skull bone which is having the below the skull we are having the dura mater. So dura mater is two layers which is made up of two layers. Okay, so outer periosteal layer and inner meningeal layer. Okay, so this layer will be called as what? Periosteal layer. Okay, and this one will be called as what? This one will be called as meningeal layer. Meningeal layer. Clear? And this is what? This one will be called as dura mater, isn't it? Okay. So what is this? This one will be said as arachnoid mater. So dura mater. After that, below that, what we are seeing, that is arachnoid mater. Okay, arachnoid mater. And what we are seeing, this is the special type of connective tissue which is connected to the pia mater also. Okay, from the arachnoid to the pia mater will be called as what? Trabeculae. Trabeculae. Okay, yes, that is the connective tissue of the arachnoid mater. It belongs to the arachnoid mater, but it is adhered to the it is slightly potentially attached to the pia mater. Okay, so this one is the pia mater. What is this? Pia mater. Okay, so this is about the layers of the meninges. See, if I want to show you the spaces between the meninges, okay, the spaces between the meninges, I will take this one as a elongated one. Okay, the space between them, here we are having what? Here in this side we are having the subdural space. What you call subdural space, and this space will be called as subarachnoid space. Okay, and above the periosteal, this one. Okay, above the periosteal and below the periosteal and above the meningeal, this layer, this one will be called as what? Epidural space. Okay, what is this? Epidural space, or we can call it as extradural space. So I will tell you by writing neatly for understanding purpose here. So here there is a presence of what? Here there is a presence of skull. Clear? And for the skull, it is tightly attached. It is tightly attached by which layer? That is periosteal layer. Okay, this one is the periosteal layer. Clear? Periosteal layer. And below the periosteal layer, another layer will be there. That one will be called as meningeal layer. Okay, what is this? Meningeal layer. So it is attached. It is slightly attached and it is open here. Okay, at the central of the sagittal section of the brain. Okay, at the sagittal section there is a channel. Okay, there is a opening between, see, from the from the temporal aspect, and in the middle sagittal aspect. From the temporal, it is attached to the periosteal layer, but when it runs towards the sagittal, okay, towards the sagittal, that time there is a space between the mid, between the meningeal layer and periosteal layer. So this area which contains the endothelial linings, okay, this one will contains endothelial linings. So that endothelial linings, that it will makes a channel along the front aspect to the occipital aspect, okay, it will makes a channel, okay, it will makes a channel like this, okay. So in this channel, what happens, there is a drainage of what, there is a drainage of the CSF, okay, there is a drainage of the CSF which will act as a venous drainage, will be called as dural venous drainage, okay, sorry, drainage or the sinuses, okay, sinuses, okay, this is the sinuses. So first we saw the dura venous sinuses, and now we will see another aspect, that is the space between periosteal, this is the periosteal layer, and this one is the what, the meningeal layer. Between the periosteal and meningeal, there is a space called epidural space. What we call epidural space. This is the epidural space. Okay. In the epidural space, the arteries are there. Okay, artery will be present. That artery will be called as middle. Okay, what is a middle meningeal artery? Okay, middle meningeal artery. Clear? Okay. So this is middle meningeal artery. Next, so the dura mater contains the meningeal layer and periosteal layer, inner meningeal layer, outer periosteal layer, and this one is a thick and tough fibrous tissue. Okay, this is a thick and tough fibrous tissue. Dura means it is a tough, mater means is a mother. Tough mother which protects the brain will be called as dura mater. Is that clear? Okay. So the next space will be, sorry, next layer is, so I will take that in a blue. Okay. So this one is what? This one is the arachnoid matter. What is this? Arachnoid matter. So arachnoid matter, above the arachnoid matter and below the meningeal layer, inner meningeal layer of the dura mater, there is a space. Okay, there is a space. This space will be called as subdural space. If it is above the meningeal, then it is epidural. Below the meningeal, then it is subdural. Okay, subdural space. Okay. So in the subdural space, we are having what? In the subdural space, we will see the veins. What type of veins, sir? The veins is called bridging veins. What do you call? Bridging veins. Okay, bridging veins. Clear? Yes. Next, after the arachnoid matter, below the arachnoid matter, there is a presence of okay, next the very thin layer and a soft layer which attached to the brain parenchyma. Okay, which attached to the brain parenchyma. Okay, this one will be called as what? Pia mater. What do you call? Pia mater. Pia mater. Okay, so the pia mater which adheres to the brain parenchyma. So near to the brain parenchyma, that is near to the pia mater, is a gray matter, because the peripherally it is a gray matter is there, and centrally it will runs along the axons, will mix the white matter in the next. Okay, so here the below the arachnoid, there is a space will be called as subarachnoid space. What do you call? Subarachnoid space. This one is subarachnoid space. Okay, in this subarachnoid space, what will be there? The CSF will be there. Very importantly, CSF will be there, and also circle of Willis. I already shown that circle of Willis, isn't it? Where the circle of Willis I will show here. So this one is the circle of Willis, isn't it? In this circle shape is there now. Okay. This circle is present where? This circle is present in the subarachnoid space. Okay, in that we will see what? In that we will see there is a presence of what? There is a presence of anterior cerebral artery. We will see the middle cerebral artery. We will see the posterior communicating artery and posterior cerebral artery. These are all things they are present where? They are present in the subarachnoid space. Clear? Okay. In the subarachnoid space, these things are there. Now, if any break in the meningeal artery, that will makes the bleeding in this space. So that bleeding will be called as epidural hematoma. What do you call? Epidural hematoma. Epidural hematoma. Okay, epidural hematoma. And if there is any break in the next bridging vein. Okay, if any break in the or rupturement of the bridging veins will leads to the what? This area. If any bridging veins, if it is break, that time there is a bleeding. This bleeding in the subarachnoid space will be called as subarachnoid hemorrhage. Epidural hematoma or epidural hematoma or hemorrhage, or this one will be called as subdural hemorrhage. What do you call? Subdural hemorrhage. Clear? Okay. Suppose in the circle of Willis, at the subarachnoid space, if anything, if it breaks or rupturement of the circle of Willis will leads to the what? Will leads to the intracranial pressure and rupturement of this CSF will increase the intracranial pressure. Okay, it will increases in the intracranial pressure. Okay, and very importantly, it will also makes what? Hemorrhage. What type of hemorrhage? Subarachnoid hemorrhage. Okay, yes. So one by one we will understand everything. So this one, dural sinus, is also known as what? We will call this one as a suprasagittal sinuses. Okay, because it is supra, above, superior. Okay, and sagittal section. That's why it is called suprasagittal sinuses. And now we will see one by one about the dura mater. Okay, yes. Firstly, we discussed about the dura mater. Dura mater is a outermost layer of the meninges, isn't it? And which is present below the skull bone, The two layers of the dura mater is periosteal layer, and also this is outer periosteal layer, inner meningeal layer, isn't it? Okay. Next, dural venous sinuses are located between the two layers of venous drainage into where? So located between the two layers of dura mater, venous drainage into that will where it will drains. Okay, this venous drainage where it will exactly drains into, that will drains into the internal jugular veins. Okay, next, So dural reflections are falx cerebri, tentorium cerebelli and falx cerebelli. What is this, sir? So in the, okay, here I will show the temporal lobe and this lateral sulcus, as you know, frontal, and this one is the what, occipital, isn't it? So there is a presence of what, cerebellum, isn't it? Okay, so this is the cerebellum and this one is the cerebrum. Now if it is divides here, look at carefully, if it divides this one, this dividing of the two layer of dura mater will be called as what, two layer of the dura mater, sorry, the meningeal layer of the dura maters and other layers of the other layers of the brain except periosteum layer. Okay, periosteal layer, except periosteal layer, all the layers which are uh, which are which are connected, and it is separating the what, it is separating the two cerebral hemisphere, so that one will be called as falx cerebri. Okay, this one is falx cerebri. Okay, like this, if it is separating the layer which is separating, called the space will be called as falx cerebri. Okay, next, then what is the tentorium cerebelli? So the dura mater which flaps inside between the cerebrum and cerebellum, this area will be called as what, falx cerebelli. What you call falx cerebelli. Then what is, sorry, we will call it as tentorium of cerebelli. We will call it as tentorium of cerebelli. Then what is the falx cerebelli? Falx cerebelli means this cerebellum will be there now. So if I show the posterior aspect of the cerebellum, so if this is the posterior aspect of the cerebellum, okay, so this which is separating the dura mater, which is separating the two cerebellum hemisphere into two halves, that one will be, that folded will be called as falx cerebelli. So don't confuse with the cerebelli and cerebri and cerebellum. Okay, this is the cerebri, that is the cerebelli. So this one is about the dura mater. Dural reflections are three, that is falx cerebri, tentorium cerebelli and falx cerebelli. Middle meningeal artery is supplied by the maxillary artery. Maxillary artery is supplied by internal carotid artery, isn't it? So next we will discuss about the arachnoid matter. Arachnoid matter is middle layer of the meninges. It is a middle layer of the meninges, underneath of the which matter, underneath of the dura mater. Okay, underneath of the dura mater. Space between the arachnoid mater and dash mater is subarachnoid space, that is pia mater, isn't it? So arachnoid mater and pia mater, between what space will be there? Subarachnoid space. Subarachnoid space contains CSF. Small projection of arachnoid matter into the dura mater is known as what? Actually it will be called as arachnoid granulation. To allow the fluid to enter into the dural venous sinuses. This one is the suprasagittal venous system, and here there is a subarachnoid layer, and also the fold of that arachnoid matter enters into the venous sinuses. That one will be called as arachnoid granulation. This, okay, arachnoid granulation enters into the venous drainage. Okay, so I will show you here this side. Okay, here, so this one is what, where it will enters this side. Okay, so if it is entering, if it is entering like this, this one will be called as arachnoid granulation, where the CSF is drainage to the dura venous dura venous, dural venous sinuses. Okay. Next, pyometer, arachnoid granulation, allow the fluid to enter the venous, dural venous sinuses. Next, pyometer, the last and final thing, it is durameter. Pyometer, last. The pyometer is located below the arachnoid matter, isn't it? Yes. Soft mother is the meaning. Okay, it is the meaning of pyometer. Okay. See, dura matter means what? Dura means tough. Matter means mother. Okay, matter means mother. And arachnoid. See, arachnoid means it's a web-like structure. Okay, web-like, or we can call it a spider. Okay, spider. So that is where it is spiding. It is spiding to the pyometer. Clear? As arachnoid matter means mother. Pya means what? Soft tissue. Yes, the soft tissue is adherent. Adherent means attached to the on the brain parenchyma, brain tissues. That one will be called as pyometer, isn't it? It is the meaning actually. Soft mother is the meaning. Clear? Okay. Adhere to the brain surface and the spinal cord also. Not only to the brain, it continues all the way from the brain to the end of the terminal end of the spinal cord. Clear? It follows the contours of the brain. That means wherever there is a gyrus and sulcus, every gyrus, sulcus and fissures and falx, everything it will follows. That's what the pyometer is. Okay, so I think we have discussed much, and so please do remember the meninges of the brain, which is very important for the exam to understand, and also for the ventricles of the brain. Ventricles of the brain we will discuss tomorrow. Thank you for watching this video.